The following portion of Daytime is sponsored by the Jasin Facial Rejuvenation Institute. If you're wanting to get a facelift without the bruising, swelling, scarring, or the long recovery time, we have some really good news. There's a procedure called the Simplicity Lift that will leave you looking younger and refreshed. It can be done under local anesthesia in about an hour and only requires 2 little incisions. Dr. Michael Jasin from the Jasin Facial Rejuvenation Institute is here to tell us more. Hi, Dr. Jasin. Nice to have you back.
Thank you. Good morning, Cindy.
The Simplicity Lift, what is it?
Well, this is a technique I've developed over the last few years, and basically what I've tried to do is draw on 26 years worth of experience of doing facelifts and cherry pick key components of different techniques that I've either utilized myself or that I've been exposed to and try to roll them into one small incision technique that will maximize the benefit for the patient but minimize the downtime because we're not traumatizing the tissues to the same degree.
Who's a good candidate for this?
Well, that's one of the beauties of this procedure is that there's a wide range of people that are candidates for this procedure. For instance, a middle-aged person who's starting to develop the signs of aging with some mild laxity and sagging in the neck and the jawline. This is a great procedure for them because they can get back to activities very quickly, minimal downtime, but yet get a nice natural-looking result. And because the deformity's minor at that stage, they can go back and have this done and not have it be obvious that they've had something done, so they can kind of slide it under the radar.
Right, people just think you look refreshed.
Right, you had a great vacation, you look really rested, I don't know what you're doing, but you're doing great, your hair color different, something like that.
That's great.
On the other end of the spectrum is a more mature patient who starts to have concerns about anesthesia, side effects, and so forth, and wants to keep it simple. And so we can do this procedure under local anesthesia and not bring anesthesia complications into play.
That's great. Now, we have a photo of a woman that you worked on with the Simplicity Lift, and this is facial contouring comes into play here as well?
Very much so.
Okay.
We've learned that over the last few years with our fillers. This patient had a Simplicity Lift, but she's got some added fullness in the jowl and neck areas. So what we're doing there is actually removing some volume rather than adding volume in some key areas to get a better looking jawline and neckline, and then we filled that depression between her chin and her jowl area to give her a more continuous jawline by using an injectable filler. So we've added volume in one area, removed volume in another to enhance the results we get with the lift. Very
nice, and you're right, she doesn't look pulled tight. She just looks refreshed.
Well, that's the key thing. We want to maintain a natural look, and today's patient is very, very keen on having it look natural and not overdone.
Very good. Now we have another picture to look at, another example of the Simplicity Lift. Oh, wow. Look at her.
Well, this is an interesting story. This patient came in from Oregon to have her lift done, and we did some filling around the mouth, and she actually came back subsequently, and we did some filling in the cheek area. And you can see it's not just about lifting and tightening anymore. We want to rejuvenate things by lifting what's sagging, but we also need to add contour and volume to key areas where we've lost it, and that's what gives us that rejuvenated, youthful look versus that stretched, pulled, and tight look.
When you talk about adding volume, you're not talking about sucking out the fat, or are you talking about taking it from one place and putting it in another, or are you putting some other kind of filler in the face?
Well, you can do that. Typically, we don't get enough volume of fat out to re-inject it very well. We usually have to go to another area like the abdomen or the tummy. But many times we're using synthetic fillers such as Radiesse, which is a semi-permanent filler, to give us longer-lasting results, which the surgical patient wants. But do it very simply.
So, honestly, on Friday afternoon, somebody could have this done, and by Monday, they could be back at work?
Pretty much. We usually have people able to go back after a long weekend with the proper hairstyling. It's a small incision in front of the ear to just back behind the earlobe, so if the hairstyling is such that they can cover their ear with their hair while the sutures are in place for a few more days, they can actually get back to work in less than a week with the sutures still in place.
Wonderful. One more shot to look at. Patient, there she is.
A good example of, again, a natural rejuvenation. The neckline and jawline are much improved. The eye area has been improved by doing some additional procedures, but not looking overdone.
I know you've got an upcoming seminar in Sun City Center.
We do. On January 26th, we'll be in Sun City Center from 10 to 12, and then in Brandon, we have a seminar on February 21st.
Dr. Michael Jasin of the Jasin Facial Rejuvenation Institute, thank you very much. And again, for more information on what we've talked about, call 888-815-3223 or just log on to jasinfacial.com. We'll be right back. The preceding portion of Daytime was sponsored by the Jasin Facial Rejuvenation Institute.